Ataxia Telangiectasia is the topic in our abbreviated AT. And Ataxia Telangiectasia is basically a pediatric disorder. And the three fundamental aspects of it are ataxia, which is poor gait, telangiectasia, a big long word, which essentially are small dilated blood vessels. And they can appear either on the conjunctiva or on the skin. And then there's the third component is the sinopulmonary infections, which can occur recurrently. Now, what is the reason this is happening? Well, AT occurs because there's a mutation in a protein called ATM protein. And this ATM protein is involved in detecting DNA damage and controlling the rate of cell growth and division. Now, when this protein has a mutation, what will happen is the rate of cell growth and division is not properly conducted, and that will allow cells to proliferate, and that can lead to cancer. So these items I wanted to quickly point out. Now, in addition to that, you also have deficiencies of B and T cells, and that leads to a deficiency in immunoglobulins. And the key ones are IgA and IgE. This one is by far the most. 80% of patients with AT will have IgA deficiency. So let's get into some of the symptoms. So we talked about ataxia. Well, ataxia, what is that? That's basically a gait problem, unsteady gait, poor gait. And this is the first symptom that will occur. Usually is noticed when the child starts to develop a walking, and you can see that. The next one is the big long word, telangiectasia. And I encourage you to look this up on the internet to see what this looks like. They're basically small blood vessels, small dilated blood vessels. And they can appear on the skin, or they can appear on the conjunctiva. And they're pretty characteristic. The third thing that can happen is the sinopulmonary infections. And the reason this happens is because you have a weak immune system. And the weak immune system, characterized by the B and T cell defects and the lack of immunoglobulins such as IgA and IgE. And then I touched on this earlier. There's a large number of cases that can progress to cancer because that ATM protein has a mutation in it and doesn't allow proper control of the rate of cell growth and division. So how do you diagnose this? Well, a lot of it is clinical, the symptoms and the presentation, but you can measure the levels of IgA, and these will be low. You can also measure something called alpha fetoprotein. And alpha fetoprotein, for reasons unknown, are high. It's just one of those things that's associated with this disease. And then another thing you can test are a karyotype. And what this shows is actually very interesting. It shows that ATM protein that normally detects DNA damage obviously is not working properly, because you will see these chromosomal breaks. It's very highly specific, but these are some of the key diagnostic tests. And the treatment basically, it's kind of limited. You replace the immunoglobulins that the patient lacks intravenously. And then you treat the sinopulmonary infections with antibiotics. So it's still, unfortunately, very limited as to how you can treat it. So let's look at some clinical vignettes. 4-year-old girl is brought to the office by her mother because of skin lesions on the face and arms. She noticed them first on the eyeballs and then on the cheeks and the elbow crease. They do not appear to bother the patient. The child's medical history is significant for a gait disorder that began when she started to walk and progressively worsened, and for recurrent sinopulmonary and skin infections. She now has an awkward swaying gait with choreic and athetoid movements. On exam, there are multiple non-blanching dilated blood vessels present on the bulbar conjunctivas, on the nose and on the cheeks, and antecubital fossa. The child is drooling and has erythematous scaly patches with thick purulent crusts on the corners of the mouth. Which of the following is most likely diagnosis? Well, they put everything together. All these skin lesions, these dilated blood vessels, that's telangiectasia. And then there's a whole bunch of stuff about her gait disorder, and that's basically ataxia. And then they're talking about recurrent sinopulmonary infections, which is definitely part of that disorder. So it's all spelled out for you. Choice A. And then finally, a 4-year-old child is evaluated by a neurologist because of difficulty walking. Neurologic exam documents ataxia, mental retardation. The neurologist notes the presence of multiple telangiectasias involving the conjunctiva, ears, and antecubital fossa. The child also has a history of multiple respiratory tract infections. Immunoglobulin studies on the child would most likely demonstrate an absence of which of the following? Well, another very good question. The most common one, 80% of patients with AT will have IgA. So that's, without a doubt, the most common one. So you can eliminate these ones since it doesn't even include IgA. So now you're down to A and B. And it's a tough one. A lot of these immunoglobulins are involved. But if you look at which one other than IgA, the next one is IgE. And that's unfortunately just something you just have to memorize. So the answer would be choice A